so back to what I was saying, our aim is to widen participation, sort of helping us to generate new ideas and overall better outcomes for patients. At Future Frontline, it's important that everything we do is accessible, so everything should remain free of charge in the future. That's quite a thing that we try to stick to, really, and really promote that accessibility and make sure that everyone does benefit from what we do. So yeah, I will introduce you to the guests that we currently have. So we have Claire, who is our clinical psychologist. Who's going to tell us a bit more about what she does and the importance of her role. We also have Jess, who is a trainee clinical psychologist. It's lovely to meet you all. And Lizzie, of course, who is our psychology student, psychology team lead as well. And yeah, I wondered if you'd like to introduce yourselves a little bit more. Do you want to start, Claire?
Yeah, so as Sophie said, I'm Claire and I'm a clinical psychologist. I work in the NHS and I currently work with Psychosis. So yeah, welcome to everyone.
Jess, I think you might be on mute.
Oh,
no worries.
One day I'll not do that, but not today apparently. My name's Jess Mclaren. I'm a trainee clinical psychologist and I'm currently based in Scotland. And I am rotating between different placements, but I'm currently on placement in a learning disability service. So yeah, that's me.
Lizzie, would you like to introduce yourself?
Hi, I'm probably the least qualified here. I'm in my final year doing my psychology undergrad at the University of Leeds, but I live in Birmingham.
Oh no, don't worry, you're more qualified than me. I'm second year, so a little bit behind you. Yeah, so this session is sort of aimed to be sort of more work experience based rather than what sort of grades we need to get into certain degrees and stuff. And we just sort of, the aim is to learn more about each role and discuss like maybe routes into possibly following certain careers, and in this case clinical psychology. Yeah, so I was thinking maybe if we started sort of talking about the, you know, the usual question of like, why do you want to go down the clinical psychology route, or why you have decided to pursue psychology. I'm wondering who would like, if anyone would like to begin with that.
I don't mind going.
Yeah.
So I chose to study psychology because I had my own experiences with mental health problems when I was a teenager. And I grew up in a family where mental health was quite prevalent. I had a lot of family members that struggled. And I guess kind of what drove me was trying to understand like why this happens. I think obviously everyone knows about mental health, but I think for me, I've always been quite like scientifically minded. And I think I was just really interested in understanding why things go wrong in the brain and what's actually happening to like manifest all these like abnormal thoughts and behaviors. And then the flip side of that as well is like being able to help people as well, because I think growing up surrounded by it just kind of, I always felt quite helpless, like I wanted to help but I didn't know how. So I thought that a psychology degree would like really give me both the knowledge and the practical implications to kind of help others in the future.
Yeah, I think that's a really good answer. Like generally I think having sort of that drive from your own sort of personal experience is quite important in pursuing like the career that you think is relevant, really. I was wondering if Claire, would you like to go next?
Yeah, so yeah, I think I've always been quite interested in psychology. I guess like Lizzie said, I think, you know, if you don't have experience yourself, you know people that do have experiences of mental health. So it's kind of everywhere. So I've always just been interested in understanding that, in helping to support people going through that. I suppose like there's a question of like why psychology, but there's also a question of like, why clinical psychology. I guess that's like a bit more specifically as well what the talk's about today. Because before I became a clinical psychologist, I actually worked as a cognitive behavioural therapist, so a CBT therapist. So I was already sort of supporting people who were experiencing sort of like depression, anxiety, trauma, OCD, a whole variety of things. And I guess you know, that's a really fulfilling career in itself. But I think for me, what I drew me to clinical psychology specifically as well is I think there's also scope for like change, like outside of just one-to-one therapy as well. So sort of supporting members of the multidisciplinary team, so supporting other professionals and sort of trying to make, you know, change happen at like a higher level as well. And I think that's something that once I sort of, you know, got into the therapy career, what drew me to clinical psychology as well. So yeah, that's me.
Yeah, that's really good. Jess, would you like to go next?
Yeah, of course. My answer's quite similar to Claire's actually. But yeah, I was always kind of interested in mental health. I think just even growing up when I did, it still wasn't something that was widely talked about. And I think that's why I was always kind of interested in it. And I was interested in the brain as well when I was doing biology in school. I remember thinking, you know, we know so much about the kidneys and I don't know, the stomach and stuff, but the brain was like this kind of thing that I guess we're still trying to understand how it works in its entirety. So that always just fascinated me. And when I was then picking my undergrad options on UCAS, I was just trying to find something that I thought can kind of combine those things. And psychology was the one that I chose. And and I think then, like what Claire said, why clinical psychology is also an important question, because there's lots of kind of similar professions that do allow you to work in mental health or allow you to work with the brain and behaviour. And I guess, yeah, the thing I really like about psychology is that it allows you to use lots of different skills. So you're not just using therapy, you're learning how to do like neuropsychological assessments. You're learning how to do that kind of consultation work and supervision work with other practitioners. So it's just a really varied role, and also the research side of things as well. So that's why part of the reasons why I've ended up choosing clinical psychology and why I enjoy it.
It does sort of seem quite as you say, quite a varied role. You've got really, even within the career, it seems that you've got different options of what sort of to specialise in sort of a way. I find that definitely interesting as a student, sort of looking to the future of what I want to be. It's definitely something I'm going to consider. I was also thinking that it might be quite nice for those that are considering going down the route, sort of what a typical day in the life sort of involves as a clinical psychologist or a trainee or a student. I found that, especially when I was at school trying to decide what to do, that there wasn't really much insight into just a typical day. I was wondering if you'd maybe like to start, Lizzie, as a psychology student.
Sure. So I think something that maybe I think it's kind of across the board, but I went to uni expecting my day to be like full of lectures and seminars and be completely back to back, and it's literally not like that at all. I think my first year I maybe had about 12 or 13 hours of contact time a week, which seemed like nothing. I think going from college to having just 12 hours a week seemed like nothing. So there's a lot of like independent study time. So if you have like a lecture, like I think in first year my lectures were like an hour long, but then from that you had like loads of reading to do and research and stuff, or like preparing for assignments, or just generally like reading around topics and looking stuff up. So a general day will kind of consist of that really, and my contact time's kind of decreased as I've gone through the years. So it's the most in first year, and then second year it was a bit less. This year, I mean, obviously it's been COVID, so it's all been online, but it's literally been like 4 hours a week, so it's been really low. But that doesn't mean that you don't have work to do, because you have loads. My degree was mainly assessed through exams, so I had 5 modules and then 5 exams per semester, with a couple of assignments as well. So I think most psychology courses you have to do like lab reports, which is where you conduct like a little mini experiment, usually just like within your class, and then you have to go away and write it up, like you'd write up a normal journal article. And that seemed quite daunting at first, especially getting your head around stats, because that was something that I ever imagined myself doing. And I didn't even realize it was a part of psychology. But we had to do a statistics module each semester of the degree. But there is a lot of help out there, and even though statistics is maths, it's not really maths, if that makes sense. Like basically a lot of the statistics stuff we did was just inputting numbers into this program, this computer program that like calculated everything for you, and you just had to interpret it. So I'd say, like, if you're not maths minded, don't let the stats put you off taking psychology, because that is such a small part of it. This was a massive ramble, but yeah, so basically it's less contact time but a lot of independent studying.
Would you say that the work has sort of, the amount of work has changed at all as you've like progressed through uni?
Yeah, so I've had less contact time each year, but the amount of what you're expected to do outside of that has increased. So this year, for like each lecture I had, they wanted you to read like between 3 to 5 journal articles. And then I had 3 modules, and for each of those modules I've had to do a 2,500 word assignment, and then had an exam at the end of the semester. So it feels like there's always something to do or something to work on.
Definitely, yeah, it does sound like a lot. I don't know how you managed to juggle everything. Yeah, definitely. Jess, I was wondering if you'd be able to go next and sort of describe as like after having done your degree and now a trainee clinical psychologist.
Yeah, sure. So yeah, sorry, Lizzie was taking me back there to SPSS.
Yeah.
It's just that software. I'm like, every time that gets brought up, I just get memories of undergrad and lab reports. So I can take you through a kind of day in my life now as a trainee, although it's a wee bit tricky because I do different things different days of the week, so I'll maybe take a wee bit longer to answer it. So
that's absolutely fine.
I've got kind of 3 different types of day as a trainee. So I've got like placement days where I work in the NHS in a variety of different mental health teams, and we switch between different placements as part of our degree. So so far I've done placements in adult mental health, in older adult, CAMS, which is children and adolescent services, and now I'm just in learning disabilities. We usually spend, it depends on my course, I'm in Glasgow University, we spend like maybe 3, sometimes 4 days a week on placement. So that's kind of doing, and on those days it would be like a mixture of like admin work, writing up all of our notes, seeing patients face to face or over video or telephone at the minute, to do kind of therapeutic work. But it might also be things like attending or running groups. It might be things like observing our colleagues, doing things like supervision and consultation work. And sometimes it's things like creating resources or delivering training to people. So that's just a kind of variety of the different things we do in a day. So it's really varied, and as a trainee we tend to have like maybe a little bit of a lower caseload than what a qualified member of staff would have, and we tend to get like more time for supervision and support, like getting observed doing the things that we do, so that we're kind of, our supervisor can check we're doing things right, and that we're kind of learning. So that's like a placement day. Those would be like some of the things I would do. And then I also have teaching days, which is where our university will put on lectures for us and workshops for us, where we learn about lots of different topics in clinical psychology. And yeah, that varies wildly. It'll cover lots of different things based on what placement we're on. So at the minute we've been getting like learning disability teaching, so it covers lots of different things like how to assess dementia and learning disabilities, or how to adapt different forms of psychological therapy when you work in that population. So yeah, we usually get a full day of teaching at least a week.
Do you tend to find that those sort of help you in your day-to-day role, like you transfer skills from what you've learned in those lectures?
Yeah, generally they're very helpful, and especially I think what trainees always feedback to our course anyway is like, especially like the workshops and things are really helpful. As much as we all moan about role plays sometimes, or like with the thought of them's a bit, there are things like that are great. So sometimes the course will put on like practical things as well to help develop practical skills. And I know for myself, I'm always referring back to my lecture notes for things, if I've got a client, say, in a learning disability service where I'm doing a dementia assessment, one of the first things I do is go back to my lecture notes and go, what did I learn on Zoom a few months ago about this? So yeah, they're really good and really good resource generally. Yeah. So that would be like a teaching day. And then sometimes we have study days as well, which gives us a chance to like do catch up on our research work, because to do like a thesis and a mini research project, and to do some reading as well based on our lectures. So
yeah, it sounds very varied. But yeah, no, it sounds like you've got a good grasp on your spread of different days. Claire, would you be able to describe sort of what your typical day is as a qualified clinical psychologist?
Yeah, definitely. And I suppose just in case it's helpful, like what Lizzie and Jess have said, like that really fits with my experience of undergrad as well, and of doing the clinical psychology training as well. So yeah, that was quite sort of like typical from my experience as well. But yeah, like Jess said, I think I can tell you about my typical day as a clinical psychologist, but I think you said yourself, Sophie, there's such a range of things that you can do. So a typical day for me will be so different for a typical day of another clinical psychologist, which is great because you can really just sort of do what you're interested in. So for example, one of my placements in training was on a stroke team, so that my typical day there was completely different, working in a hospital, working with sort of physical health colleagues than it would be now. So yeah, I think that's just like helpful to mention, because I think it's kind of, you can find a role that kind of fits what you're interested in, and even you can do, some people work full-time in sort of research and things like that, if that's more your thing. But yeah, in terms of my typical day, obviously therapy is a part of the role as well. So yeah, just to remind you, I work in a psychosis team. So I offer one-to-one therapy, also we'll sort of run groups. A lot of the work as well, often for many psychologists, myself included, is working within the multidisciplinary team. So working with my colleagues of other professions. So every morning we have an MDT, like a team meeting, where we sort of discuss new referrals, sort of cases who maybe need a little bit more urgent support. And we sort of think about those things together as a team. And outside of therapy, there's also sort of supporting colleagues as well. So it might be sort of providing a bit of a psychological perspective to the work. Maybe if people are sort of like struggling with a particular case, it might be sort of having a bit of a chat with them to help understand what's going on. And that can be sort of like formal consultation, like you can book in a slot for that, but actually much more often it's much more sort of informal. So it's I suppose providing that sort of psychological support within the team as well. As Jess mentioned, you might also sort of do training. So I recently gave some training to my team on something called sort of compassion focused therapy, which is a way of working I really like. So every month in the team we have sort of slots where we provide some training to the team. What else might I be doing? Oh yeah, supervision. So accessing supervision myself. So anyone working therapeutically as a psychologist or as a different type of therapist should always be getting supervision. So that's just a really helpful space where you talk about your cases and you have space to reflect. So I attend my supervision, but I also offer some supervision as well. So I offer that to someone in my team, but also sort of privately, I supervise some clinical psychologists as well, outside of sort of my NHS work. I'm trying to think if there's anything else. Yeah, there's just lots to be involved in. Also, you might be joint working with other colleagues. Like I'm hoping to start some joint work with some of our family therapy colleagues. So yeah, there's lots of scope for sort of different things.
Yeah, I found that really interesting. Like I don't know much about supervision, so that was sort of interesting to hear about. I think trying to define a typical day in any career is probably quite hard to do, but I think that's definitely given some more insight into your careers. You mentioned the multidisciplinary team and the people that you work with. Could you describe like what sort of members you do work with?
Yeah, so the team that I work in, which is probably quite common in terms of quite a few mental health teams. So there'll be sort of psychiatrists who are sort of like medically trained colleagues. There's also within my teams, there's something called care coordinators. So they're the people that sort of like they're sort of like mainly in charge of the care. They're sort of like the go-to person for the people that we support, and they're often either nurses or social workers, although sometimes they might also be occupational therapists. We also have an occupational therapist in our team. We also have like a support time recovery worker who can do sort of like more active work and sort of be a bit more out in the community, offering that sort of support. We've got family therapists in our team, so not every team in adult mental health services, that's quite rare. It tends to be that in children's mental health teams there's more often family therapy. I'm trying to think, I don't want to forget any professions. Yeah, I think that's it in the team where I work at the moment.
It's quite a big team.
Yes.
Yeah.
It's really nice because you can sort of, you know, really learn from your colleagues as well, and then hopefully they're learning, you know, from you as well. So it's sort of nice to have that range of perspectives, and it means that when we're discussing, you know, supporting people, different people have different ideas and different professions have different strengths, and so hopefully if we can sort of draw on those and work effectively together, we can, you know, support people better as well.
Yeah, definitely. I think, yeah, working cohesively is quite, well, one of the most important things in terms of providing patient-centred care. So it certainly sounds like you've got enough minds on board there. So I was wondering, I was going to ask about sort of career progression for those that are a little bit earlier on in terms of their clinical psychology journey. Lizzie, I was wondering if you sort of could give some ideas of sort of what you're thinking of doing in terms of going down the clinical psychology route, and sort of if you talk about anything you're doing.
Oh, sorry.
It's all right.
Sure. So I think the thing with a psychology degree is, I think especially compared to other healthcare degrees like nursing and medicine, where you have a lot of like placement time, like there is no placement in undergrad psychology unless you decide to take a whole year. My uni calls it like a year in industry, so that's where between your second and third year you take a year off studying and you go and work somewhere for a year. But unless you choose to do that, there's kind of like no formal work placement involved in the course. So I think the best thing for any undergrad student to do, or even anyone like thinking of working mental health, is just to get some kind of experience in it. Like a lot of that is volunteering, which can feel a bit annoying sometimes, especially if you're like doing a lot of work, but it's such a good way to get experience. There's a lot of places you can do volunteering. I think generally it's harder to get experience, especially at the moment, on like NHS wards and stuff because of like confidentiality and obviously at the moment COVID, but volunteering for helplines is a great place to start. So I volunteer for SHOW and I've just been interviewed to be a childline counsellor, so I'm going to start training for that soon. So they're great places. The Samaritans is also a great one, and just trying to get some experience really and seeing if you actually enjoy doing it, because I think a lot of people think they will like working in mental health, they like the idea of like helping people, but then the reality can be very different. So I would say just reach out to a lot of people. Like charities are really great to volunteer for, or I volunteer for like my local NHS CAMS, and I've volunteered there for like nearly 5 years now, and they're really good in terms of like letting me help run groups or like sitting on an assessment or doing admin. So I guess just asking around and seeing what's there is really, really helpful. And then I think another good thing is like reading books or listening to podcasts from like clinical psychologists or people within the field, as some like books or podcasts give like really good insight into what it's actually like on the job. Because I think it's quite a long route to get there, as like Jess and Claire will probably talk more about. And I think everyone in my family seemed to assume that if I did psychology at undergrad, then I'd come out and I'd be a qualified psychologist. And I've literally had to explain to them a million times it doesn't work like that. So I think like familiarizing yourself with the route and then deciding how you want to get there is like really, really important.
Yeah, congratulations on that role with the counselling though. That sounds
thanks.
I'm also a Shout volunteer and I would recommend that. It is, I think you do have to be 18, but for anyone that is a little bit older in terms of sort of working out what career they want to go down, I would recommend that one definitely. Jess, I was wondering if you'd be able to sort of share how you've progressed like since your psychology undergrad.
Yeah, sure. Yeah, as Lizzie was just saying, it can be a long journey, so I'll try and keep this kind of brief. Yeah, I graduated my undergrad in 2016, but I, like a lot of undergrad students, as Lizzie talked about, you have quite a lot of study time, and you don't have that opportunity to get sort of any kind of practical hands-on experience with clinical populations. So I did do some paid support worker work when I worked as an undergrad, to make a wee bit of extra money as well, so I could fund living expenses and things, and also to just, as Lizzie said, find out if that was something I actually enjoyed doing and I would enjoy doing. And I did take on some volunteer work, but just because of, you know, living expenses and life, I couldn't volunteer loads. So it was just a wee point to say to people that, you know, it doesn't need to be volunteering every week. It doesn't need to be volunteering lots of hours. You know, I think when you're applying for jobs in future, or you're applying for the doctorate course, something that is important is just like how you can reflect on those experiences as well. So if you're not able to volunteer, that's I don't think that should be a barrier to entering into this profession, or I'd like to think it wouldn't be, but it can give you an advantage when you're going for jobs if you do have a little bit of experience, whether that be paid support worker work or working as a volunteer in some way. So yeah, during undergrad and into my masters, I worked as a support worker for like a local third sector organisation that helped people with mental health needs in the community, and also in a couple of supported accommodation centres in Glasgow, which is where I lived at the time. And that was a great experience. It was really hands-on. It involved a lot of building rapport with people really quickly. It involved sometimes helping the team manage risk and things like that. So I think when I look back on that experience, it really gave me a good insight into what it would be like to work, say, in a mental health service. So I think roles like that are great, and especially if they're NHS, I think that's even better, because then you can sometimes get a wee bit of insight into like some of the policies and procedures and things in the NHS as well. So from there, I did do a master's. I did a clinical health master's, which had a small placement on it in the university, which was like in the kind of university psychology services team that helps like students with their mental health. So I ran a group at the university with that. And whenever I was finished with that, I got a research assistant post that was just a short 6-month post. It was actually ended up being less than that, in an educational psychology team, because that's something I was also a wee bit interested in, and I really enjoyed that. But I think at the end of that, I felt I was more wanting to do clinical psychology. And then so I got a couple posts in the NHS that were kind of like, one was a guided self-help worker role, which is kind of assistant psychologist-y. It was kind of band 4 working in the NHS. And then I got an assistant psychologist post after that. And then I got into the doctorate. So that was kind of my route of going into things. But if anyone wants me to, I realise that was a bit of a ramble again. So if anyone wants to ask any questions about that at any point, or at the end, or I can go over any of that again. But yeah, that's roughly the route that I took. Yeah.
You mentioned something about deciding between like clinical psychology and educational psychology. What made you pick clinical over educational?
A couple different things. The thing about it, so I really liked working in the educational psychology service, and the role I had was really great because it was all about the Attainment challenge, which is this idea that people from lower socioeconomic backgrounds tend to statistically don't tend to perform as well in primary schools in Scotland. And so the Scottish Government have put in a big initiative to try and address that and do some research and work out how those kind of patterns exist in primary schools, and then to try put interventions and things into place. So that's kind of what my role was about with that. So I really loved it. But why didn't I want to do it? It's like, I think it was because a big combination of things. the EdSec role in Scotland, and I might be wrong, but I think down in England as well, is kind of shifting away from doing more one-to-one work and doing a lot more consultation work, as I think the ClinPsych role is as well. Another thing with the EdSec role is that it does a lot of the work is focused on learning and in school, whereas I was also interested in things like neuroscience, interested in, say, working in mental health and adult settings, interested in clinical health. And I think EdSec is very focusing on learning and young people's mental health. And really, on a really practical term, at the time, the EdSec course in Scotland wasn't funded. So financially, at the time, it wasn't an option for me as well to choose. So yeah, it was a big combination of things why I ended up choosing clinical psychology.
Yeah, that's very interesting to know. I had no idea about the difference in sort of funding.
Yeah, it is funded now in Scotland, but it's a bit of a weird system where it's like a bursary.
Okay.
And I don't know if they're looking to change it again. But yes, so yeah, I would say that's the main reasons. But it's interesting because they're very similar roles in lots of ways. That they still do assessment work, they still do formulation work, they still do consultation work with teams. So it is similar in lots of ways, but they just focus in on that kind of one population and those types of learning needs. So
yeah, no, definitely very interesting to sort of listen to sort of, because I've considered both educational and clinical, and it's interesting to hear other people's sort of opinions based on that. Claire, would you sort of be able to describe sort of how you continued in your career?
Yes, I'll try not to ramble. It's hard because I think, like everyone said, it can be quite a long journey, and so often and people end up doing lots of bits and bobs sort of along the way. So I suppose to echo like what Lizzie was saying, really I did quite a bit of volunteering during my undergrad, not so much. I think I did a little bit at school, but it was really during the undergrad that I did quite a lot of volunteering. And I think unis are quite good. There's quite a lot of opportunities to do that, and it means you can, like Lizzie said, sort of get a bit of a sense for what you enjoy and what you're interested in, and whether this is something you actually want to do or not. So I think that's a good rationale for doing it. But also, if you do enjoy it, it's a nice experience, it's a meaningful experience. So I'd quite recommend doing that if you're sort of on that path and you're interested. And I wouldn't, it's obviously always good to get experience, but I also feel like it is a long path. So if you're still at school, don't feel like you have to do all the volunteering, you have to do all the stuff, and like Jess said, some people can't do it because you need to work or you've got other commitments. So don't take that to heart too much, but it can be a really good opportunity. So I did quite a lot of that at university, and then I think that made it quite a bit easier for me actually when I graduated to get a job. So similar to Jess, I had quite a short stint as it was like a fixed term research assistant post in health psychology. And while I enjoyed that, I think it was very much like an office job, and I think that really taught me that what I liked about the psychology is, I think research is important, and like Jess, that's something that drew me to clinical psychology. But I think for me it's about the connection with people and being with people and doing that work. So I think after that I looked more to sort of clinical work, and then after that I've made most of my experience before going on to the doctorate was actually in something called Iaps. So Iaps is there's so many acronyms in psychology, so apologies, but yeah, Iaps stands for Improving Access to Psychological Therapies, and it's basically in England, I think it's slightly different in Scotland and Wales and Northern Ireland, but it's essentially where most people get sort of sent if they're experiencing mild to moderate anxiety or depression. So the sort of like guided self-help, which was Jess mentioned, there's a role called Psychological Wellbeing Practitioner, and that's a year-long university course, a postgraduate certificate. So you study 1 or 2 days a week, and then you're in an NHS setting the rest of the time, and so you're kind of like learning on the job, you're studying and you're doing the work. So I did that course, did that for a year and a bit. And then I actually did further study to become a CBT therapist, which is a postgraduate diploma, also a year, also couple days study, couple days working, and they're both NHS funded courses as well. So you sort of get paid while you're doing them. And then I did the doctorate, and I'm actually doing some further study now as well. But not everyone has to study that much. Some people don't do any masters, any PG certs, any PG dips. So again, don't let that put you off. But then that's sort of the path I took. And I guess I think I said this at the beginning when I talked about why I was interested in clinical psychology. I think that sort of Iaps career is a career path in itself. So some people might become a CBT therapist or a psychological wellbeing practitioner, and that's for them sort of they'll find a career from there and sort of progress from there, and you can become a senior version of that role, or you can sort of specialize. And so if you're really just interested in sort of the therapy part of it, and you're interested in cognitive behavioral therapy, that's sort of a whole psychology career in itself to consider too.
There are so many options out there in terms of careers within psychology. And it's worth acknowledging that there are so many routes to getting to clinical psychology. Everyone does have very varied experience, and just because one person hasn't done something then doesn't mean that they're not as successful in terms of their career as anyone else. I was wondering if we could maybe sort of brainstorm sort of skills that you think are most useful in developing if you were considering trying to aim towards clinical psychology. Sort of also, what skills do you think are the most important in your day-to-day life? Lizzie, I was wondering if you had any sort of skills that you could take away from the experience that you've done.
I think, do you mean in terms of my degree or like work experience?
Maybe towards sort of more work experience.
Sure. So I guess something I've taken away is probably, and a lot of this comes from shout training, which you might be able to relate to, is I thought rather naively that a lot of psychology was kind of about like fixing people, or always trying to like jump in and like tell them how they should be feeling or giving them advice, whereas actually a lot of it is just kind of about listening to them and like validating their emotions, and not necessarily trying to always fix things or take them away. And I think that art of listening to people I've really had to develop, because I'm someone who will talk because I hate silence, it freaks me out. But that's something that I've really had to like work on and kind of come to terms with. And I know it sounds a bit bleak, but sometimes like you can't help everyone, and that's not always your fault. I know it sounds quite like drastic, but I think I kind of thought that from my like degree and having training, it would kind of make me some kind of like superhuman who could save anyone from everything, but it doesn't really work like that.
Yeah, I think it's important to not let it affect you in terms of your own sort of mental health when you are trying to, as much as you can, and then if that does, maybe seek support, or definitely seek support, but letting yourself sort of have that boundary in terms of separating your work from your own sort of mental health. Jess, would you be able to share sort of some skills that you've learned? I think you might be on mute.
Yeah, I thought those were really good reflections, Lizzie, and it reminds me of my time volunteering whenever I was an undergrad as well. I guess if you're interested in pursuing clinical psychology as a career, I think we talk about like kind of general skills that's really important, and some of those things is things like just being able to build up a rapport with someone, and adapt your communication for whatever their needs are. Just kind of those basic skills that you get from socializing and from kind of working in settings with different people that access our services. So that's why I guess work experience is really important to kind of just be developing those skills. But I think just thinking back on my days as a support worker, that was something you had to develop really quickly, because quite often you were just meeting for someone for the first time, but then supporting them to maybe do some of their their therapy homework or something like that. I think just those kind of soft skills, and I don't know if soft skills is the right word, but those kind of general skills in building rapport with people and forming a therapeutic relationship with people is really important. But then, of course, there are the more kind of like specific skills that psychology, the clinical psychology doctorate look for you to start to kind of develop, which would be things like research. So a lot of that you can get from your undergrad or from work experience that you get. So just, you know, learning all the things that Lizzie was talking about before about stat software, because those are real skills that you develop as part of your undergrad and are really important. And I've been asked about them in job interviews. So sometimes I think when you're learning things, you think, oh, am I going to use this again? But you do. And then things like assessment and formulation and intervention, audit, all these kinds of things. And I think a lot of psychologists will say one of the most important skills we have is formulation, which is that kind of like helping or collaboratively helping someone make sense of what's going on with their needs and their difficulties right now, but also taking account of things like their strengths and things, so that you can work out where to intervene and what's going to be helpful, what behaviours or what thoughts are going to be helpful to target, you know, in somebody's mental health or whatever other need that they're coming with. So formulation's a really important skill, and I think you can start to develop that wherever you work, and especially if you start to go on to do kind of like assistant psychologist roles, or if you start to work in Iaps, you know, those are great settings as well to again use the support of a clinical psychologist or a supervisor to really start to develop those skills as well.
Would you say that's sort of what they're looking for in terms of if you're trying to get onto the clinical psychology doctorate? Is that?
Yeah, I would say so. I think there is somewhere in the depths of the internet, there's like a standards of clinical psychology doctorates thing that the BPS produce. I can't remember exactly what it's called, but something like that, and the BPS produce it, and in it lists like the 9 core competencies of a clinical psychologist. So it's like the 9 core skills, and it includes things like assessment and formulation and intervention work. So that's really helpful. I would say that's really helpful to read even if you're an undergrad, just to get a sense of like, what are the skills, what does a clinical psychologist do, or what do they kind of have to develop skills in. And then it can be even helpful just to look at the bits of maybe work experience or the things you're doing at university and start to think, oh, I'm actually starting to learn a bit about that, or oh, I'm actually maybe doing a bit of that in the support worker role or the volunteer work that I do.
Sort of starting to link all the different things you might be juggling with sort of aiming towards a certain career. I think reflection is also probably quite important in terms of thinking about what you've done, and it's not even just about the quantity, it's sometimes sort of reflecting on specific examples. Claire, would you be able to maybe describe sort of skill sets you've developed?
Yeah, it's interesting you said reflection, because that's one of the things, I mean, yeah, definitely agree with everything Jess just said as well. I was thinking a lot of those things, but yeah, reflection I think is a really key one, because I think, you know, particularly because, you know, you're working with people who have sometimes been through really sort of difficult experiences, and I think sometimes it can sort of feel easy to just, you know, like just sort of crack on and, you know, do what you're doing. But I think reflection is really important, and it's sort of you know, building up that ability to reflect on how you're feeling as well, and what the work brings out in you. And you know, if you're not acknowledged, if you don't have the sort of space or capacity to reflect on those things, then you can't I suppose, you know, you can't sort of do anything about it, or you can't manage it. But I suppose also just being aware of, you know, things like your own prejudices and your own assumptions. And again, if you're not giving yourself the space to reflect on those, you could be sort of inadvertently bringing things to, you know, to the work that are probably a bit more helpful to actually address and to think about and to work through. So I think reflection is really, really key. And I think that's a skill that, you know, it can be a bit of a tricky skill to learn, because in a way it's like, I think Jess said about like, you know, communication can be a bit of like a soft skill in a way. It might feel like a soft skill, but actually sometimes it's those more vague things that can feel a bit harder to develop. But I think even just sort of you know, just asking yourself the question of, after you've done some work experience, like how you know, how am I feeling, how am I doing, you know, how am I responding to these situations? You know, what might that be about? So it doesn't have to be anything fancy, it doesn't have to involve any models. It's just sort of checking in with yourself. And I think there's obviously so many skills, and you know, there's the more specific ones and the more general ones, but I guess for me, I know it's maybe a bit vague as well, but I think, you know, communication, it sounds obvious, but it's so key, because it's not just, again, in a therapy sort of setting that you're communicating, but a really big part of the job is communicating with different networks. So particularly if you're working in learning disabilities like Jess's, or in the children's, when I was working in CAMS, you're just constantly working. You're working with schools, you're working, and with adults as well. You're working with social care, like if there's any sort of safeguarding things. Often people are involved in different teams. So you might be working with probation, you might be working with, you know, the GP is always going to be a part of the picture. So I think being able to communicate, and that's a very different type of communication, particularly if you're working with like a 5-year-old, the way you communicate with them, the way you communicate with their parents, and then the way you're communicating with their school, that's all going to be quite different. So it's sort of, communication, I would say, is a really key one.
Yeah, I agree. I think communication is really important. I think also just sort of having that adaptability and sort of changing how you behave in certain situations and implement certain models and tools. So I think that is sort of coming towards the end of our discussion about our clinical psychology. There is a Q&A, so if anybody that is watching does want to submit a question, I will pick a few questions for us to answer. I can see Lizzie has answered quite a few. Thank you, Lizzie.
Yeah, sorry, I've just been like answering some as they come up, if I can.
That's amazing.
I think one question that I can answer was, on average, how long on average does it take to become a qualified clinical psychologist? I think Claire would be best to answer that.
Sorry, I misheard you. Oh, yours are frozen for me. Oh no, I think I might be frozen.
No, you're not frozen for me.
Oh, ignore me. Yeah, so I think you saying, Lizzie, that's something you couldn't answer.
Yeah, I think either one of you would be better to answer it. How long on average does it take to become a qualified clinical psychologist?
Yeah, so it varies wildly, and the only data that I think there is on this is there might be more data actually that I may be wrong, but some data on it is collected by the Clinical Psychology Forum. Is it the ClinSci Forum? They've got a poll that they've been running for years, where they kind of ask people like, how many years has it taken you to get on? And I think it varies. I think the average is kind of usually between like 2 and 5 years roughly, but it varies quite a bit. I know in my course there's some people that I think the shortest amount of time would maybe be about a year or 2 years. I think 2 years is about shortest time. And then I know people that have maybe like on my course that have maybe done different jobs before, or have done research for years before, or whatever, and then have maybe like came to do the doctorate like maybe in their late 30s or 40s. So it varies wildly. So there isn't, I think you're right, Leslie, I understand why it's hard to answer, because there's not really like a set answer. And I don't think maybe Claire knows, but I don't know if like the clearinghouse take data on that, or if anyone does collect data on it other than the ClinSci Forum.
I'm not sure, but that would be the place to go. That's reminded me, actually, sorry, this is a different question, but when you were talking about skills, on the Clearinghouse website, which is like kind of like the UCAS for clinical psychology, they've got like, unless they've changed it, they have like a job description of a trainee clinical psychologist. And, you know, on a job description, you'd have like qualifications, skills, experience. So it does actually sort of break those down as well. So that's quite a useful resource to look at. But yeah, to answer this question, yeah, just like Jess said, it's it's quite variable. People have different paths.
Somebody has asked about whether you have any tips in terms of rejections for the clinical psychology doctorate, and how you'd improve your application.
Well, I can talk a wee bit about this. I don't know, Claire maybe can as well. I don't know, but I've applied. I think this is actually one of the questions as well. I think I'd seen that up top. Someone had said, "Did you get on the first time?" So I'm maybe taking two birds with one stone just now by answering this. But I applied twice. So I applied when I was kind of 2 years out of undergrad, and I just started working in the NHS as a guided self-help worker. And I wasn't successful that year. I got one interview and didn't do very well at the interview. So it was a definite learning experience for me. I think my nerves definitely got the better of me on the day, and found the questions kind of less straightforward and more challenging than I'd been expecting at the interview. So I think the kind of lessons that I kind of learned from that, I guess, was that just really to think about the value that I put on getting onto the doctorate, and kind of like just take that pressure off myself a little bit for interview, and kind of learn to manage my kind of performance anxiety, nerves on the day, and also just the way I prepared. So I think the first time I prepared for an interview by reading loads and loads and loads, and probably over prepared a bit, and got myself quite anxious about it. So for the second time, I really consolidated my notes and did some mock interviews with the team I was working with at the time. I think that was really helpful, because then that's you're getting practice of the actual thing that you're going to be doing, by getting that interview practice. So that was really helpful. But it is really hard, and I think the hard thing about the clinical psychology doctorate is not all courses give feedback. In fact, a lot of them don't, and they also, sometimes it can feel a little bit like there's it's a bit unclear why somebody's say not gotten an interview, just because it's so competitive, and different courses don't publish their selection criteria and things. So sometimes rejection can be really hard, and it can be hard to kind of make sense of that and kind of process that and think about that, how you feel about that. But yeah, I hope, sorry, that was a wee bit of a ramble, but I hope that I guess that was just a wee bit of my experience with it, and how I dealt with it. And yeah, I was successful the second time I applied.
Yeah, that's amazing. Because I heard a lot of people, a lot of places don't offer feedback if you don't get an interview. Am I right in saying that?
Yeah, yeah, I think that tends to be the case. I think the reason they give is just the volume of applicants, which I guess you can understand. Yeah.
Do you have any tips, Claire, in sort of how to strengthen your application after you've had a few rejections? I don't know if it's something you've experienced.
Yeah, so I similar to Jess, actually. I applied twice as well. I applied when I was pretty much I was just in my first job after undergrad, and didn't get any interviews or anything, and then I actually just didn't apply for a few years. I was, like I said, I was working in Iaps, and there's lots of people who do apply when they're working in Iaps, but I think I was just sort of seeing where that took me. And then when I applied the second time round, I think I was just in a very different place. I think it took the pressure off, because I was sort of happy in what I was doing already. It didn't feel like the be all and end all of getting onto the course. And I know, for friends who've applied, and sometimes, people do apply year on year and do get rejections, and it's really hard, and it's such a long drawn out process, because the applications are normally due around November, December time, and then some courses have stats tests, and there's only 2 I think that do, so you can avoid those if you want to, but when I applied that second time, it was that, so you've got to revise for that, and then you've got the interviews, and they're from March to May, so it's quite a long process. So I think for people who are applying a couple of years in a row, it takes quite a chunk out of your year, sort of emotionally, and I think it's really, really hard. So I think my advice is, based on my personal experience, is like have some plan Bs, you know, there's other you know, it's like, I'm really glad I'm a clinical psychologist, but it's not the only part of my life, and there's other psychology based careers out there. So my advice would be, you know, find other things that you're interested, or sort of try and develop your career in a way, like try and find experience that means you can progress in other ways as well. So if you get it, that's great, but it doesn't feel like the end of the world when it doesn't happen. So I think that would be my advice in terms of dealing with rejections. In terms of strengthening your application, I think what I did the first time is what a lot of people do, which is just like a really long list of all my experience. And I don't think that's what they want to see, particularly because it's so competitive. Lots of people have really great experience. And I think what helps you to sort of stand out is with the reflection bit. So yes, you have, you know, whatever experience, but it's actually your ability to reflect on that and what have you learned from that, that I think the courses like to see and help you to stand out, and sort of, rather than saying I'm reflective, you're sort of showing your reflexivity as well. So that would be sort of like my main tip for strengthening applications based on what I did the first time, which was just a long old list of just what I'd done so far, which probably isn't what they wanted to see.
I'm sure a lot of people fall into that trap of sort of,
yeah,
is everything I've done give me
yes,
this place. But yeah, it's definitely something we can all learn from. Especially sort of aimed towards Claire and Jess, what sort of point did you think you were ready to initially apply to the doctorate? Like, when did you sort of feel ready?
For me, it was maybe when I didn't feel ready when I was doing my master's and working as a support worker. I think just because I hadn't really had a lot of experience sort of in delivering psychological interventions or doing formulation or any kind of psychological assessment work. It's mainly support worker experience I'd had. And at that time, I think I had that perception of, to get onto the doctorate, you've got to have an assistant post, so you've got to have all this experience. So I think at that point, I didn't feel ready, and so I didn't apply that year. But I think looking back, I might have applied anyway for the experience and brought what reflections I could, because I know a lot of people who have got onto the doctorate course working as support workers, especially if they work like as a support worker in an NHS kind of mental health service. Yeah, and I applied the following year when I just started working in the NHS as like a guided self-help worker, and I got an interview. So so I guess that it just goes to show that you don't need loads of experience to start thinking about applying, but I think you just need to have an awareness of what the courses are looking for in terms of being able to show that you can start to develop some of those skills and meet some of those skills of clinical psychologists. And obviously the more experience you get, the you know, that might, and the more able you are to reflect on your experiences, that will increase your chances of getting onto the course.
Yeah, by the sounds of it, sort of when you sort of begin questioning whether you are ready, it's sort of worth considering just as a learning experience for how to maybe do better in the future. Claire, do you have anything to add, really?
Yeah, I think looking back, I think that first application I probably wasn't ready. I did have a bit of experience. I was I don't think I'd finished even my trainee PWP, so that's like the same as guided self-help. That's kind of what it's called in England, the psychological wellbeing practitioner role. So I was still sort of learning that. And yes, I had a bit of experience, but I think having had a few more years, I just felt a bit more ready for it, and a bit more able to sort of, yeah, you know, take those opportunities and sort of learn from them, and yeah, I suppose just go into it with a different mindset. I think in hindsight, like I said, I did wait a few years, and I probably could have applied sooner. I don't know if I would have got on, but I don't think I sort of like applied the moment I was ready. Maybe in hindsight I would have been ready a little bit earlier, and certainly a lot of the people I trained with on the course were psychological wellbeing practitioners who got on without doing any sort of further training. So, or obviously assistant psychologists, support workers, lots of people. So you don't have to have as many years as I did. Yeah, but like I said, I think for me it helped. It, you know, I took the pressure off a little bit for the interview, because it just didn't feel as sort of all consuming, all important when I was there.
So I'm going to do the last question now. I think so as a clinical psychologist, I was sort of wondering, and somebody else has asked as well, what sort of do you spend the most hours on in a week? Sort of therapy, is it supervision, sort of, what do you find it's time on?
You're going to be disappointed, but it's admin. And also, whatever role you do in any of these future frontline talks, I guarantee you, most professions are going to say admin. The reality is, you spend a lot of time doing paperwork. I don't know, you might disagree, Jess, but that's what I would say.
Yeah, it's a lot of admin, and I was just working in CAMS, so a lot of liaison, like what you said before, a lot of liaison with other professionals. And probably less time doing therapy than you might think. I don't know if we've got time for one more question, but I'm just noticing one that I get asked quite a lot.
Yeah, if you want.
Some universities better than others for getting onto the doctorate, but I'm not sure if they also mean are some universities better than others for studying the doctorate. So the answer for if you're doing the doctorate in clinical psychology, the actual university you choose to study the doctorate, I would say, I don't know if Claire or Lizzie would disagree with me, but I would say that doesn't matter as much in terms of like, say, job opportunities and stuff when you qualify. It matters more maybe a wee bit like what research interest that uni has, and then what kind of clinical leaning that they have, you know, like what sorts of types of therapy that they specialise in, things like that. And so it's more about what you're interested in, I would say, for the doctorate course that you pick, and practical things like where you want to live and things like that as well. Undergrads, in theory it shouldn't, and I know lots of people who've been like successful in getting onto the doctorate, or know people have been successful in getting into doctorate from lots of different unis, like kind of more prestigious unis or the OU, or a variety of different unis. But I would say there probably are some subtle advantages to going to universities that have a kind of research psychology department, or that maybe have a clinical doctorate attached to them, just because you might end up having more opportunity to have lectures from people that are kind of doing research or doing clinical work in psychology, and that might sort of subtly help improve your kind of interest in things, or maybe there might be some opportunities to get experience through that. But overall, it shouldn't. So I hope that answers that question.
And I just jump on that before we end. I would really like to stress to anyone who's picking a uni course to like go on the uni website and really read like the course breakdown of what the modules are and what you're actually going to be studying, because although, like Jess said, it shouldn't really matter, and if the course is BPS accredited, then they will all be quite similar. But that being said, like, it's really important to actually look, because I picked to go to uni in Leeds, but I think with hindsight, I would have preferred to go to a uni that focused more on like practical skills and clinical skills rather than like heavy science. But I didn't really think of reading the course specification. I just assumed it would be the same everywhere. So yeah, I would really say read that. And for undergrad, the advantage of going to a Russell Group university is, like Jess said, that they all have like research centres, so they're all like doing their own research, which means there's like heaps more opportunities to get involved with stuff and even like do your own projects, which is like really helpful for third year when you're writing your dissertation. So yeah, I guess it's just really thinking about what you want and making sure you find that in your undergrad course.
Thank you, Lizzie, and thank you for answering so many questions on the Q&A whilst we were discussing.
It's fine. I answered as many as I could.
Yeah, you've done an amazing job. So that's the end of our session today. I just want to say thank you to the guests for coming to this. I know it was really kind of you to take your time and spend it discussing sort of your career. The QR on the left hand side is feedback for this webinar. I do apologise for the technical difficulties at the start, and the QR code on the right is the Buy Me a Coffee link. this will always remain free, but if you do feel that if you'd like to donate, we do give that option, but obviously it's not compulsory at all. Thank you for everyone for attending. I will close the webinar now.
Thanks, guys.
Yeah, thank you.
Thank you.